Assessment of mouth, throat, nose, and sinuses. First is to identify your patient.
May I know your name po?
My name is Kelly Junicio po.
Kailan po yung birthday nyo?
September 22, 2002 po.
Okay, ma'am. So today, I will be assessing your mouth, your throat, your nose, and your sinuses po. And in order to do that, I will be needing your cooperation para po maging accurate yung assessment natin. Is that okay, ma'am?
Okay po.
Inspect the external nose for any deviations in shape, size, color, flaring, or discharge from the nares. The nose must appear symmetric, straight, and uniform in color. No presence of discharge or flaring. Lightly palpate the external nose to determine areas of tenderness, masses, displacement of bone, and cartilage. When lightly palpated, there are no tenderness and lesions. Then determine patency of both nasal cavities through the nostrils by occluding one nostril at a time and asking the client to sniff.
Isa pa po. And then sa kabila naman po. Yan. Tapos inhale, exhale, or sniff po kayo. Isa pa po.
Then inspect nasal cavities using flashlight or nasal speculum for the presence of redness, swelling, growths, and discharge. The nasal mucosa is dark pink, moist, and free of exudate. Then palpate the maxillary and frontal sinuses for tenderness. Palpate the frontal sinuses by using your thumb to press up on the brow on each side of the nose. Then palpate the maxillary sinuses by pressing with thumbs up on the maxillary sinuses. Percuss the sinuses by lightly topping over the frontal sinuses and over the maxillary sinuses for tenderness. Frontal and maxillary sinuses are non-tender on palpation and percussion. Then document findings in the client's record. Next one is the assessment of mouth and oropharynx. Inspect the outer lips for symmetry of contour, color, and texture. The lips are uniformly pink, moist, symmetric, and have a smooth texture. And the client can purse lips when asked to whistle. And then put on gloves. Then inspect and palpate the inner lips and buccal mucosa for color, moisture, texture, and presence of lesions. Use a penlight and tongue depressor to retract the lips and cheeks to check color and consistency. The buccal mucosa of the client appeared as uniformly pink, moist, soft, glistening, and with elastic texture. Inspect the gums and dentures. Ask the client to open the mouth, put on gloves, and retract the client's lips and check gums for color and consistency. There should be no discolorations of the enamels, no retractions of gums, and it must be pinkish in color. Inspect the surface of the tongue for position, color, and texture, and ask the client to stick out the tongue. The tongue of the client is centrally positioned, pink in color, moist, and slightly rough. Then inspect tongue movement. Place your finger on the external surface of the client's cheek. Ask the client to press the tongue's tip against the inside of the cheek to resist pressure from your fingers. The tongue must offer strong resistance. Then inspect the base of the tongue, mouth floor, and the frenulum. Ask the client to touch the tongue to the roof of the mouth and use a pen light to inspect ventral surface of tongue, frenulum, and the area under the tongue. And then check for Wharton's ducts. It is the opening from the submandibular salivary glands located on either side of frenulum on the floor of the mouth. And then check for a short frenulum that limits the tongue movement. Then palpate the tongue and floor of the mouth for any nodules, lumps, or excoriated areas. Use a square gauze pad to hold the tongue to each side. Palpate for lesions, ulcers, or nodules. No lesions, ulcers, and nodules are apparent. Then inspect the hard and soft palate for color, shape, texture, and the presence of bony prominences. The smooth palates are light pink and smooth, while the hard palate has a more irregular texture. Then inspect the uvula for position and mobility. Apply a tongue depressor to the tongue and shine a pen light into the client's wide open mouth. Note the characteristics and positioning of the uvula. Ask the client to say ah and watch the uvula and soft palate to move. While the mouth is wide open, note any unusual or foul odor. The uvula of the client is positioned in the midline of the soft palate. Then inspect the oropharynx for color and texture. Keeping the tongue depressor in place, shine the pen light on the back of the throat. Throat is normally pink without exudate or lesions. Inspect the tonsils for color, discharge, and size. Using the tongue depressor to keep the mouth open wide, inspect the tonsils. Tonsils should be graded. Grade 1, which is tonsil behind the pilar. Grade 2, between pilar and uvula. Grade 3, touching the uvula. Grade 4, in the midline. And then elicit the gag reflex. Inform the client about eliciting gag reflex. Touch the posterior one-third of tongue with blade to stimulate the gag reflex. Gag reflex must be intact. That would be all. Thank you.